Podcast 1, Weeks 1, 2, and 3. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing, and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at weeks 1, 2, and 3. Being pregnant is an incredible experience, but it can be a little scary too because you don't know what lies ahead. Knowing what may happen during pregnancy and why may help you relax as you learn how to take good care of yourself for the next 38 weeks. Material in our podcast is divided into weeks because that's the way doctors look at pregnancy. We'll look at pregnancy the same way. So let's get started. We're going to cover 3 weeks in this first podcast. The first 2 weeks aren't really very important because you're not really pregnant. Let me explain. The average length of a pregnancy is 38 weeks or 266 days from conception to baby's birth. Most women don't know the exact day they get pregnant, but they usually know the beginning of their last period. So for medical purposes, the beginning of pregnancy is actually figured from the beginning of your last menstrual period. From this perspective, pregnancy lasts 280 days, that's 40 weeks, even though you're not really pregnant the first 2 weeks. Confusing, huh? Because you're not really pregnant for the first 2 weeks, there's not a lot to talk about. So let's jump to the first week you really are pregnant, which in medical terminology is week 3. Week 3 is the week you actually get pregnant. Once you're pregnant, your body begins to go through changes that can indicate pregnancy. It's more than a missed period or morning sickness. You may want to take an at-home pregnancy test to confirm you really are pregnant. As soon as you know you are, call your doctor's office to make your first prenatal appointment. It can take some time to get in, so don't put it off. All through pregnancy, your actions will affect baby's development. It's important to know how. The first trimester, the first 13 weeks of pregnancy, is the most critical time in a baby's development. All the major body organs and systems of the fetus form during this time. They'll continue to develop throughout your pregnancy, but the first 13 weeks are the most important. Things you eat, drink, or take in during this time can greatly affect your baby, so you need to be cautious about everything you're exposed to. Let's take a look at some of the things that can negatively affect baby's development. Do you use tobacco? Avoid it. The effects of tobacco intensify during pregnancy. Some women use smokeless tobacco products instead of smoking cigarettes. Don't. And electronic cigarettes are not a safe alternative. Use of any tobacco product contributes to nicotine in your blood. It's one of the main causes of problems in baby's development. The best thing you can do is quit smoking or using tobacco in any form. You may be wondering if you can use stop smoking aids. None of these products is recommended during pregnancy. If you smoke and want to stop, talk to your doctor about it. Even if you don't smoke, you could be at risk from secondhand smoke, cigarette smoke in the air, or third-hand smoke. If you can smell it, it's there. Both secondhand and third-hand smoke can be harmful to you and baby. Another substance to avoid is alcohol. It may be one of the worst substances your developing baby can be exposed to, and it's not just liquor. Be careful with over-the-counter cough and cold remedies and mouthwashes too. Many contain as much as 25% alcohol. If you use alcohol during pregnancy, it can lead to fetal alcohol spectrum disorder. Baby can suffer birth defects from mild to serious. Many women think they can drink non-alcoholic beer and wine during pregnancy. Sorry, you can't. Even if a product is labeled non-alcoholic, it still contains some alcohol. Don't take chances with baby's future. If you drink alcohol during pregnancy and it affects baby negatively, you bear the burden. Will that glass of wine or that beer be worth it if your baby has lifelong problems? Sometimes you need mild pain relief for some minor problems. Be careful using various pain relief meds during pregnancy. Check with your doctor before using aspirin, Advil, Motrin, or ibuprofen. They may increase the risk of miscarriage. Read labels on every medicine or substance before you take it. If you need a pain reliever or fever reducer and can't reach your doctor for advice, you can use acetaminophen, Tylenol, for a short time. We've had women ask us if they can use marijuana during pregnancy, especially for morning sickness and relaxation. No. This applies to medical marijuana too. Marijuana in any form can disrupt baby's brain development and cause other problems, such as stillbirth. The more marijuana you smoke or ingest, the higher the risk. Don't eat foods laced with marijuana either. And avoid secondhand marijuana smoke because it can increase the risk of stillbirth and other problems. How about caffeine use? Caffeine is a stimulant found in beverages, foods, and some medicine. The most important impact of caffeine, especially in early pregnancy, is an increased risk of miscarriage. As little as 2 cups of coffee a day may double your risk. Cut down on caffeine or eliminate it from your diet completely. We also want to warn you about drinking green tea during pregnancy. Studies show if you drink only 1 or 2 cups of green tea a day within 3 months of conception and during the first trimester, you double the risk of your baby having a neural tube defect, such as spina bifida. How about herbs, botanicals, and supplements? If you use any, stop. Many can negatively impact you and baby. Stop using any substance your doctor has not advised you to take. Now, not everything is bad. Some substances are beneficial, such as prenatal vitamins. They're very important to your health and baby's, and you should take them for your entire pregnancy. Folic acid is also important during pregnancy to help prevent neural tube defects. And keep up your fluid intake. Aim for 100 ounces of fluid a day. 50 ounces should be from water, the rest from food and other beverages. Your nutrition during pregnancy is very important. Baby depends on you to provide him or her with all the nutrients needed to develop healthfully. What you eat and drink will have a direct impact on that in development. Eat a healthful, varied, well-balanced diet. The quality of your calories is important. If a food grows in the ground or on a tree, meaning it's fresh, it's probably better for you than if it comes out of a box or a can. Exercise is also important. Studies show it's beneficial for you and baby. Before beginning any exercise program, talk with your doctor. If you get the go-ahead, begin exercising gradually. There are many types of safe exercise. Ask your doctor for recommendations. Bleeding and spotting during pregnancy can cause concern. In the first trimester, bleeding or spotting can make you worry about miscarriage. During the second trimester, bleeding may happen with sexual intercourse or a vaginal exam. Bleeding during the third trimester can be a sign of placenta previa or the onset of labor. If you experience any type of bleeding, don't panic. Call your doctor. he or she may order an ultrasound exam and follow his or her advice. Now, it's not all avoid this and don't do that during pregnancy. On the positive side, there are a lot of benefits to being pregnant, and we're going to touch on many of them in upcoming podcasts. Who's going to be your medical guide during pregnancy? The professional you choose is an important decision you and your partner should make together. You have quite a few choices, such as an obstetrician or a family practitioner. Perinatologists are obstetricians who specialize in high-risk pregnancies. Pregnant women sometimes choose a midwife for prenatal care. There are different types of midwives. Each receives a different type of training. Most certified midwives care for women who have low-risk, uncomplicated pregnancies and deliver their babies. Communication with your healthcare professional is important. You need to be able to ask questions, express concerns, and talk about what's important. Don't be afraid to discuss anything. How do you find someone to take care of you? If you already see someone you're happy with, you may be all set. If you don't, ask your primary care physician for some references. You can also ask friends and family members. When you pick a healthcare provider, you usually also pick a hospital. Be sure you consider how close the facility is to you, policies regarding your partner and his participation, and whether your insurance covers the healthcare provider and the hospital before you make your final choice. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.